Welcome, my dear students, to the next module in ATCOM, that is Healthcare as Human Right. Myself, Dr. Yatish Kumar Joshi, PhD scholar, under the supervision of Dr. Sunita Vaga, JNMC Vardha. So this session will sensitize the students regarding the issues: is healthcare a right? What are the implications of healthcare as a right? What are the social and economic implications of healthcare as a right? What are the missing links? What are the implications for doctors? This also aims to encourage the student to prepare an assignment or video or speech or essay regarding the same. So let's begin. Universal Declaration of Human Rights. It was a milestone document in history for human rights. It was drafted by representatives of different legal and cultural backgrounds from all over the regions in the world. In 1948, 10th of December, the declaration was proclaimed by United Nations General Assembly in Paris. General Assembly Resolution 217A as a common standard of achievement for all the people of all the nations. It set out for the first time fundamental human rights to be universally protected, and it has been translated in over 500 languages. The Universal Declaration of Human Rights (UDR-HR) is widely recognized as having inspired and paved the way for adoption of more than 70 human rights treaties applied today on the permanent basis at global and regional levels. Total 30 articles were listed in the declaration. So, the United Nations declared in 1948 a document called as Universal Declaration of Human Rights. It had 30 articles. Out of the 30 articles, Article 25 is the article on focus in today's discussion. That is, everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing and medical care and necessary social services, and the right to security in event of unemployment, sickness, disability, widowhood, old age or other lack of livelihood in circumstances beyond his control. Motherhood and childhood are entitled to special care and assistance. All children, whether born in or out of wedlock, shall enjoy the same social protection. So as you see, Article 25 is very important for medical professionals. It focuses on the idea of universal health or universal health care, and it does not only limit to medical care, but also it focuses on the core areas which enables every individual to enjoy the basic health, such as social services, social security, sickness, old age, widowhood, and other social determinants which indirectly or directly affect the well-being or health of everyone. They also focus on food, clothing, and housing for individual, as well as sanitation. So let's begin. So the next heading: health is a fundamental right. So what do you think? Is health a fundamental right? Yes, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without discrimination of race, religion, political belief, economic or social conditions. Almost 70 years after these words were adopted in the Constitution of the World Health Organization, they are more powerful and relevant than ever. As you have seen, we were stuck by a very difficult time of COVID pandemic in last 2 years. It has made us realize that a disease or a sickness affects everyone. It does not discriminate in religion, race, political belief, economic and social condition. So why should health discriminate? Health should also be a right that everyone should be able to enjoy without distinction. Since the day one, the right to health has been central to World Health Organization's identity and mandate. It is the heart of my top priority, universal health coverage. The right to be healthy for all people means that everyone should have the access to health services they need, when and where they need them, without suffering financial hardship. No one should get sick and die just because they are poor or because they cannot access the health services they need. Good health is also clearly determined by other basic human rights, including access to safe drinking water and sanitation, nutritious food, adequate housing, education, and safe working conditions. If you see, all these conditions are very important to achieve a healthy life. Just medical services being provided or medical practitioners being available does not ensure a proper health. Basic human rights, which as mentioned, are also important for everyone to enjoy health as a fundamental right. The right to health also means everyone should be entitled to control their own health and body, including having access to sexual and reproduction information and services free of violence and discrimination. Everyone has the right to privacy and to be treated with respect and dignity. Nobody should be subjected to medical experimentation, forced medical examination, or given treatment without informed consent. Thus, why who promote the idea of people-centered care? It is embodiment of human right in the practice of care. So we should know what is people-centered care. Our services should be centered on providing benefits to the people without discrimination. Thus it will become a human right. When people are marginalized or face stigma or discrimination, their physical and mental health suffers. Discrimination in healthcare is unacceptable and is a major barrier to development. When people are given opportunity to be active participants in their own care instead of passive recipient, their human respect or right are respected. The outcome are better and the healthcare system becomes more efficient. When people are discriminated based on their religion or their financial status or their beliefs, they are not free to approach to receive health cares. It creates a stigma among the patients. It creates a sense of discrimination, which becomes a barrier for them to approach the health care providers or to approach the health care services to improve their health. It is the role or it is the duty of every healthcare provider to make them feel accepted, to make them feel inclusive. This will enable them, this will make them feel respected, and they will approach and become more participants in the healthcare system as well. The participation of every level of human being, of every financial level or every social level, will bring about a good or efficient system which will be more inclusive to all levels of patients. We have a long way to go until everyone, no matter who they are, where they are, and how much money they have access to basic human rights, and health is one of them. WHO encourages countries to respect and protect human rights in health. In their laws, their health policies and programs, we must all work together to combat inequalities and discriminatory practices so that everyone can enjoy the benefit of good health, no matter of their age, sex, religion, race, health status, disability, sexual orientation, gender identity, or migration status. So when we speak about everyone having equality or everyone having health as a right, so the idea comes because There were situations or there were times in the history like World War, like financial revolution. There were many areas in the country where there was a huge discrimination or a barrier among different races, different classes, different ethnic background or political or at social, divisions among the population, which led to a discrimination at every level. This did not stop at only the social level. It was extended in the healthcare sector as well. We will discuss few of them. Most fatal communicable diseases like TB, HIV, AIDS and malaria, if you know, are commonly prominent in the poor population, and they are exacerbated by the inequalities and inequities them. I mean to say the most poor people or the most poor population or the most population which lack the basic human services like food, sanitation or education or proper, medical services are more prone to such diseases. If they are having the equal right of basic core human, healthcare or sanitation food services, the exposure to such communicable diseases reduces. Hence, the burden of healthcare on the poorer segment or the poorer population, financially poorer or backward population reduces. The discrimination does not only lie on the poorer segment. If you focus, the lifestyle diseases or the non-communicable diseases, they are linked to a more stagnated lifestyle. They are linked to a more, a rich class of the population who enjoy a more lethargic or a lazy type of lifestyle. The determinants are also linked to richer class. The healthy, although they have safe house, safe nutrition and sanitation, but they also share a burden of lifestyle diseases which are not seen in the, much difficult lifestyles. So everyone has a segment of a disadvantaged population. We need to bring uniformity among all. Hence, everyone will be able to enjoy a more uniform life or universal healthcare services. Violation of human rights in health. Healthcare providers and receivers may knowingly or unknowingly disregard the human rights, which can become a barrier of healthcare services with poor quality of care. This violation of health threat for health increases the exposure of discriminated population to more human right abuse and exploitation. This means the poorer patient or the rich patient both can be exploited in terms of the diseases they suffer just because of the discrimination in the social status or economic status. The more rich patients are more prone to be exploited with a costlier or more premium treatments, and the poorer patients are more exploited or are having unaccess or lack of access to costlier treatments just because of their financial inabilities. This creates violation of human rights. Human rights says that everyone, in spite of their social, economic, or financial conditions, should have equal uh, availability of health care. But it is not the case. There are many cases where violation of human right takes place. Mentally ill patients especially lack dignity and autonomy in treatment provided, leading to denial of treatment or institutionalization or forced treatment, with less attention to public health services too. Hence, it is the duty of the medical practitioners to focus on providing, health as a right rather than health as a service. Human rights based approach to healthcare. This is what I was mentioning in the previous slide. Healthcare should not be provided as a service, it should be provided as a human right. It is possible when the core principles of accountability, equality and non-discrimination and participation is included in the healthcare services. Accountability. The states, officials and private organizations should be accountable for respecting human rights in healthcare services. It should not just be accountable for the treatment success or for the non-discrimination. They should be accountable for creating a healthcare service based on human rights. The services should be provided to every individual of the population despite of their location, of their financial, social and educational status. This not only includes the healthcare services, but the core health services which were earlier mentioned, providing them with equality and non-discrimination. This is very important. It has been noticed, especially in a developing country like India, which is struggling with social stigmas, with economical barriers, with higher proportion of population being in middle class, lower middle class, and poor class population. Discrimination and inequality plays a very major role in healthcare services. You all are aware that in India, exercising of human rights in providing healthcare services with equal opportunity for all is not possible, is not currently possible. There are differences, but it is our duty to focus that we strive to provide such services. Participation. Now, to develop such a system where the healthcare is based on human rights, we need participation from all the stakeholders to analyze and plan the healthcare system. Implementation, evaluation, and feedback of this system also improves when the accountability improves. It also outcomes also improve when every stakeholder of strata of every social status or economic status are involved in planning such system. So if we want to make the healthcare as a human right, we should focus on involving or participating all the members and making them accountable for preparing this system. Not only preparing, implementing and evaluating this system as well. Because participation of a middle class population is going to help more, because they are the one who struggle the more financial burden in healthcare services. So what are the core component of right to health? Right to health is possible only if the healthcare services are available, accessible, acceptable, and of very good quality. Availability of services, as you might know, is not universally spread or equally spread or equitably spread in India. The major cities or the metropolitan cities or the larger district centers enjoy more advanced healthcare services. The healthcare services are not available in remote or rural areas. So we should ensure that the availability of sufficient healthcare facility, good and services, and the programs which encourage health service or healthcare awareness should be available at every level, at every place of the country, to every population in a rural area, urban area or suburban areas. Second thing, it should be accessible. Accessibility is a very important feature. Many a times the availability is there, but it is not accessible to the most strata of the population. That is without because of discrimination or affordability. Services should be available without discrimination. Rich or poor, backward or forward, any caste, race, religion, sex or age should be able to approach these services. They should be affordable. Physical and information should be available at the at the comfort of the patient or at the ease of the patient. This makes them inclusive, or this enables the patient, or encourages every person in the population to access the healthcare. Most of the people will have, or most of the population, middle class or poor class population, does not avail healthcare services because of lack of accessibility. They have to quit their job, or they have to take a leave for a day, or they have to miss school, or they have to stop their work, or then go to access the healthcare services. But if it is accessible at the remotest location, at their own community, the access the every individual will be enabled to access the healthcare. This will overall increase the health of the population. Next is acceptability is based on ethical, cultural and international standards. You will encounter, or you will face many situations where ethical and cultural standards or international standards will become a barrier in accepting treatment. Not every ethics or cultures are acceptable by every individual. So you have to respect the culture of different, because India is a very huge, you know, country with many different ethnic races, religions, cultural and social backgrounds of people. At every different level, it is our duty to withhold medical ethics as well as respect the cultural beliefs of every individual. International standards vary. In very situations, we may face international patients which have different standards of medical ethics. It is our duty to respect the same. As an individual, as well as it is our duty to prepare a system and maintain a system. The system itself should respect the ethics, cultural beliefs, and international standards should be followed. Last but the most important is quality. Availability, accessibility, and acceptability becomes compromised if the quality of treatment that is being provided is not efficient. The treatment provided should be safe. To make it affordable, it should not be, compromised on the safety or effectivity of the treatment. The quality should be people centered. It should not be, financially driven or market driven or industry driven quality. It should be timely and equitable. Every person needs healthcare services, but the timing of health is very important, as well as it should be equitable. Equitable means an area which suffers more burden of the diseases should have more services or more healthcare provisions or services being available. But this does not mean that the area which suffer lower burden of disease or lower, proportion of diseases should be left away. They also should be available, having facilities of health services equitable to the load of the burden there. This can only be done when the accountability is given to the states and region, as well as the participation of the stakeholders is included. Providing an integrated and efficient system is only possible when accountability, non-discrimination, and participation is exercised, as mentioned in the previous slide. So, as we discussed, you will be uh, in a dilemma. All this is already being followed. But what do you think? In India, is it possible that patients from a rural village go to a higher centers which are available in only metropolitans, thousands of kilometers away from their city, and it doesn't bear a economic burden on them? No. The government speaks about they have opened so many AIMS institute, they have opened so many new medical colleges. Do you think it is really going to help to bring about universal health coverage? Universal health coverage is not about bringing out new big hospitals. It is about covering the most basic or the most lower strata of the population. If you know, most of the Indian population is poor or backward or rural based or village based. And all the major hospitals or development of healthcare services are being done in the bigger cities or in the metropolitan cities. So there is a gap between the work that we are doing and the work that is needed to make human right as healthcare services or healthcare as human right. This is an article from the Hindu paper. All these resource materials will be provided in the classroom. So it states that 90% of tertiary care centers like AIMS and JIPMER are receive patients which require primary care. That means the advanced hospital are addressing people who does not require advanced treatment. 95% of patients require basic care. Like they go to AIMS for fever and cough. But AIMS and bigger hospitals are not meant to address such issues. Those issues can be addressed at the primary healthcare center of their community. So there is something missing. What is that thing? Everyone wants to go to a bigger hospital because there is no integrated care system. What is integrated care system? Integrated care system is a system which incorporates the primary, secondary and tertiary level of cares at one level. And it has a system that based on the type of problem or the type of healthcare issue the patient is facing, they are allotted to the levels of healthcare, primary, secondary or tertiary. But in India, most of the tertiary health care is managed by the government and it is overlooked. Sorry, most of the primary health care is managed by the government and it is being overlooked. While the privatization of the tertiary care center has increased the burden of healthcare on the populations. The privatization with provision to bypass the primary care is creating a barrier of affordability and accessibility to the community. This means that any individual can directly go to a tertiary care center, and the tertiary care center has a burden of screening the patients whether they require a tertiary care or they are actually a primary care patient. So the tertiary care centers are burdened with 95% of patients who do not require tertiary care, whereas the primary care centers are being underutilized because no one wants to go to a primary care center. Most of the population wants to go to a tertiary care center. If there are systems where the primary care center has to refer the patient to a tertiary care center, only then the tertiary care center can accept the patient. So this system will filter the patients and provide the basic treatments at a primary care center. And the tertiary care center can focus on providing more treatment and more facilities to patients requiring tertiary care rather than screening the 95% of patients who don't require tertiary care. So this is called as gatekeeping. Gatekeeping is not, is not available at a, is not very developed in India. What does gatekeeping do? Gatekeeping is, it forms a proper channel in which every patient, indiscriminate of what level of financial status or what level of social status or what gender or what problem he has, they has to go through a primary care center. The primary care center decides at which, or the community center, it decides at which level of center it is to be done. Only with their referral, it goes to that center. India has more number of primary care centers. Hence, the burden of screening the patient or triaging the patients distributes. And the higher centers, which are less in number, can focus only on tertiary care providing. So, the inequality of bed distribution also reduces. Most of the patients which can be treated with primary care are screened at or filtered in the primary care center and receive the treatment there as well. So this in turn, channelizes the funds more into developing the primary care rather than, focusing on the tertiary care. Because everyone wants to go to a tertiary care center, the government has to improve more tertiary care facilities, which actually are not servicing or not providing more of tertiary care, but providing more of primary care. This in turn comes to universal coverage. All the classes be clubbed together in participating and planning and implementation of universal care will distribute the responsibility of the community to evaluate the system of healthcare, as well as it will improve the accountability, which is a core important factor of health, human right as a healthcare. When the system becomes accountable, when the participants become accountable, when the state becomes accountable for running the system of healthcare as a human right, the gatekeeping becomes very empowered. So the primary healthcare starts being utilized. When the primary healthcare centers starts being utilized, the resources or the funds starts being channelized in the right direction. The burden of healthcare reduces and overall health of the population increases. All this is possible only if the social determinants, like we mentioned, the basic or the core healthcare services like food, sanitation, education are improved. If all these social determinants are improved, the overall health is improved. Most of the primary care issues are addressed at the home level. Most of the problems are due to lack of good drinking water or lack of sanitation. They are improved at home level. So the burden on the primary healthcare center reduces. They can address more and more patients and the lack of bed reduces. So all this is a vicious cycle. Imagine a family staying in a poorly maintained, unsanitized community. It is more prone to disease. More population being in such areas burdens a primary healthcare center. So the primary healthcare center are filled. So the middle class population does not go to primary healthcare center. They either go to secondary or a tertiary healthcare center. Because the tertiary and the secondary healthcare center of the government are less, so they go to private institutes. Private institutes burden them financially, so they do not take treatment. If they do not take treatment, their social condition, financial conditions is burden and the overall health is decreased. And the people who enjoy the more financial liberty or who are rich in the society, they enjoy the treatment because most of them are insured. And when the insurance is the disease's burden of disease increases, the middle class population start purchasing insurance. Because the middle class facility population start procuring insurance, the premium of insurance increases. So the complete healthcare system becomes insurance driven, and once the premium of insurance increases, the burden of disease is also, the financial burden is also increased on the middle class population. So this is a vicious cycle. So it should not be society driven, insurance driven. It should be looked into like a health right. Everyone has the right to be healthy. Everyone has the right to have a good, basic social life, basic sanitation, drinking water. It will improve their basic health. Improving this basic health will provide a universal coverage. Universal coverage means everyone will be able to, have health as a human right, despite of discrimination. This will in turn reduce the burden on the healthcare services. Reduced burden on the healthcare services will help to ensure the gateway. And when the gateway is proper, the right utilization of every level of healthcare service provider, primary, secondary, and tertiary, will be ensured. And this will overall create a cycle which is very efficient to provide healthcare as a right and reduce the financial burden. So this is a very good vision, but everyone has to participate, and doctors play a very important role in this, because they are the ones who are triaging or who are screening the patient, who are creating and who are the major stakeholders or are creating awareness regarding the same in the population. You as the doctors of tomorrow need to encourage the patients to participate in developing this system. So in the conclusion, I would like to say that right to health is the human right. Countries, states, government sectors, private sectors, healthcare providers, insurance companies, and all the patients are the stakeholders. Participation of everybody is very important. You should participate in developing and providing non-discriminated, affordable, and acceptable healthcare. Doctors are very instrumental in observing and accounting the success of the same. So with this, I would like to end today's session. This in only aimed to make you aware regarding the health as a human right. It is a very vast topic. A few literatures regarding the same are available in the Google Classroom. You can go through the same. After going through the same, I want you guys to make an assignment regarding a small video or a debate or essay regarding what is your perception regarding healthcare as a human right. Is it available? What is the situation in India? What do you perceive it as to be? Kindly make a small essay or a debate or a video regarding the same and upload in the classroom. Thank you very much. Have a good day.